Okay, so let's talk about retinitis pigmentosa. It's an inherited disease. It can be inherited in quite different ways. The pathophysiology of retinitis pigmentosa is damage to the rods, mainly the rods in the start of the disease, photoreceptors in the retina, which is the nervous layer of the eye. The rods are damaged, which are in the periphery of the retina, and as the disease progress, also the cones are damaged and the retinal pigmented epithelium is damaged. Now, the rods are mainly used for night vision and are in the periphery of the retina. So, in the start of the disease, the patients have a reduced night vision and peripheral vision, and as the disease progresses, also the cones, which are responsible for the color vision and the acuity of vision, are damaged. The rods are mainly in the central part of the retina, especially in the macula and in the fovea, which is the central area of the retina. If you can see the fovea there, I can't point there, but I wish you can see it. So retinitis pigmentosa mainly damage initially the rods. When you look in fundoscopy, you will see hyperpigmented area in the retina, which are the main sign of the retinitis pigmentosa. Maybe I will show you some here. This is a fundoscopy, and you can see the hyperpigmentation in the peripheral area, which is sign it is a sign of the death of the rods, and the waste products are the hyperpigment you can see, and this is part of the diagnosis. Fundoscopy with this mesh-like, trabecular bone-like signs, hyperpigmented signs, are one of the characteristic signs of retinitis pigmentosa. Also, if ERG electroretinography is done, you can also see changes in retinitis pigmentosa, which is flattening of the waves. In ERG electrical retinography, there are two waves. The first one is the A wave, which is negative. It represents the photoreceptors. And the second wave is the B wave, which represents the bipolar cell, Muller cells. In a normal eye, these two waves are present. Firstly, the A wave, and then the B wave, as you can see in the left column. Now, in retinitis pigmentosa, both waves in the advanced disease are flattened. As you can see in the right column, the A and B waves are vanished. No A wave, no B wave. And ERG helps in the diagnosis of retinitis pigmentosa. Now, the treatment. The treatment is not quite easy because there is no definitive treatment that cure retinitis pigmentosa. There are things that can be done to reduce, and I don't say halt, but reduce the progression of retinitis pigmentosa, which are multivitamins, especially vitamin A and other vitamins that can reduce the rate of progression of the disease. When the disease is very progressed and the vision is very, very lost and very, very severe, there are implants that can be inserted into the retina, and it gives the patient, the blind patient, some vision of light and things like this, but this is not very good. There is no cure to retinitis pigmentosa. Now, the prevalence of retinitis pigmentosa is around 1 to 4,000 people. So it's not very common, but for genetic disease that cause blindness, it is quite common as a cause of inherited blindness. So this is about the retinitis pigmentosa. Now, if there is anyone in the family which has retinitis pigmentosa, it can be quite important to look for it and to screen for it. And this is about retinitis pigmentosa, a inherited disease that mainly damage the night and peripheral vision, the rods photoreceptors. Then it can progress to cones and the central and color vision. Diagnosis is throughout fundoscopy and ERG mainly. About genetic diagnosis, I'm not sure. the treatment is mainly trying to halt the progression or slow the progression of the disease using multivitamins, vitamin A, and things like this. Okay, this is it. This is about retinitis pigmentosa in some words. If there are any corrections, please correct me. Sorry for any mistakes if I made. Thank you, and that's it.